Hi, I'm Mark Owen Cooper. We're at the National Rural Health Conference in Blenheim, and today I have Jean Ross with me, who is the Associate Professor of Nursing at Otago Polytechnic.
Hello.
Hi. So you're speaking at the conference this weekend?
I am, yes.
And I understand that you've just released a book that you'll be talking about as well.
That's right, yes. The book is my second book that I've produced in relation to rural health, rural nursing, and its title is Stories of Nursing in Rural Aotearoa, A Landscape of Care.
Right, okay. Did it take a while to write?
Yes, it's an edited volume, so it's evidence-based research in relation to rural nurses who had been in practice for 15 years or more. And what I wanted to do was to capture their wisdom before the majority of them will retire.
I can guess that over that time, 15 years and more, there must have been a lot of changes in healthcare throughout New Zealand.
Lots of changes, and the stimulus really is the major changes of the health reforms in the late 80s, but mainly in the 90s. Right. And that's when nurses, or the occupational identity of the nurse, moved from traditional practice nurse, public health nurse, Plunkett nurse, district nurse, to the nurses themselves identifying themselves as different. Okay. And that's when they collaborated together and developed the title Rural Nurse Specialist.
Right. So they've gone from being one particular area to kind of being generalists in their own.
That's absolutely right, yes. And so the idea is, again, to capture those stories in a time when there was major change. And that change was significantly positive in that the government at the time, the national government, wanted to engage with community. So it was community driven, and that's where the rural community trusts came from. And the nurses in those trusts were able to model healthcare that was related to the rural communities, which is very exciting. The one main thing which I find just amazing is that a number of these nurses who have told their stories, they've used the word pioneer.
Right.
So the session I'm actually giving later on today is about pioneers, and to acknowledge and respect those nurses as pioneers in the healthcare system.
So I'm quite new in the medical profession myself, and a lot of the things they talk about is, how do we get more people rural, and how do we improve health outcomes in rural? And from what you're saying here, it's been something that's been ongoing for a very long time, of how do we constantly improve things in the smaller communities.
So from my experience and from the research that I've just completed, it is about working alongside and with community. It's about community being the instigator of healthcare, local solutions to local problems, and the nurse adapting their practice, being flexible to accommodate that.
Yeah. And do you have any particular stories within the book that stand out to you as key points of, right, this is something I really wanted to get across?
The word pioneer, or the notion of pioneer, what I find quite interesting is that many of these nurses 15, 20, 30 years ago established healthcare in those communities that had been never done before. For example, administering chemotherapy in local regions, transport flying nurses to get people out of rural areas to tertiary hospitals. Prime is another example, newer example. Mental health. And what I find quite interesting is that these are the themes that we're still talking about today, in this conference particularly. There's the nurse that talked about, well, there was a couple of nurses that talked about instigating chemotherapy in a rural area. Now, we're talking 20 years ago. Now, that was significant in those times. But what was more significant for the local population is that they didn't have to travel 3 hours.
Exactly.
They knew the people that were going to be looking after them. And those nurses really did prepare themselves, but stood out in developing that. And a lot of those nurses, as they have discuss themselves as pioneers, but also a number of them who have now retired are still doing voluntary work in the communities, which is quite fascinating, really. So they are local people living in the rural community, wanting to be there, but wanting to make a difference. And the difference that they want to make is equitable access to healthcare.
Exactly.
So I think we can learn from the stories. And the minister today talked about equity. And I think we have a real icon in the nurses that actually were able to develop their practice in a certain way to accommodate change.
Yeah. So it's about bringing medicine to the people, not making people go to the medicine.
Yep. And I think it's the breadth of the nursing practice, but also they just give it a go. And I quite like that. They just tried it, give it a go, see if this works.